So this is a video about discharging patients in Palmdale Regional Medical Center. It is slightly different than Antelope Valley Hospital process, a different version, and they add a different process. So first of all, so this is a test patient. From home page, you go to Discharge tab, and you are going to see, different items on the left sidebar. The order of these items may be different in your chart, but you can order these, clicking on this and moving around. So anyway, so what I have in my view is a diagnosis. So you have to review the discharge diagnosis. You can add diagnosis, for example, DKA. It's going to show up here. However, the problem with this view in Discharge tab is that you cannot reorder this. So to reorder this, you have to go to Manage. And obviously you have to refresh. So you have this DKA, you want to be this one, the first diagnosis. You click on first. And then you have to go to Discharge and refresh. And then you're going to see DKA in the first place. Anyway, in this view, diagnoses are all the problems that you knew and all problems you deal with the patient during the hospitalization, and problem is the chronic medical problems. So once you review that, you can review the documents, and then you go to medication reconciliation. So here you have a tab on the right side, the link for MedRec. Click on that. So this is same as Antelope Valley MedRec. So you just click on the medications that you want to continue. This is if you want to stop this medication or you want to write a new prescription here, you can do that. So you can write a different prescription here. Because this is a Kaiser patient, we like to order separately in Health Connect, so we are not going to send this to Kaiser. And reconcile and sign. So that is done. Discharge order. Here, this is a test patient, so there is empty. The chart is almost empty. So, but in real patient, you're gonna see some arrow here besides diet. If you click in that arrow, here it's gonna populate the diet that currently patient is on in the hospital. Same as activity. If you click right on this arrow here, you click on that, you're gonna transfer that activity as ordered in the hospital. I'm not sure about the wound care, probably the same thing. And then important thing is you have to click on discharge request, otherwise the patient is not going to be discharged. If you want, you can click on DME, things like that, but I don't usually, I leave it open. I just talk to the case manager for DMEs and oxygen, home health. I talk or I text the case manager directly. So once you submit, you're going to see home routine, a home with a, let's see, let's just say home health. And then sign. So where this is order is blocked because this is a test patient and is already discharged. So anyway, that's the idea. Once you sign it, the order is sent to discharge the patient. Now you have a procedure imaging, so you're going to see a bunch of imagings about this patient. we usually want to include those are important for the primary care doctors to review. So we normally do is you click include on that image, and then in section comment, I copy and paste the impression of that imaging. So you can do in every imagings. Procedures, I'm not sure how much you can do. You can try. And now hospital records, you dictate what happened with the patient. And then follow-up. I have templates of follow-ups, primary care, or you can just click here, Dr. Trong. I didn't know that Dr. Trong was working in Vegas, but anyway, this one. And you say time frame within 1 to 2 weeks. And then save. So next thing is physical exam here. So you dictate or you use the dot phrase, whatever you like to do. So you go through the objective and physical exam and create note. Click on create note as usual. So you review all these things and sign. And that's it. All done. Thank you for watching.